Good morning, my lord.
Good morning, Miss van der Westhuizen. Now, I understand you have a panel for us today.
I do, my lord. I have a panel of two representatives of two organisations that are members of the Human Rights Consortium Scotland. We have Miss Frances Hume from Interfaith Scotland and Mr. Clanahan, Christopher Clanahan, from the Equality Network. My lord, we were due to be a panel of three today. Unfortunately, one of the panelists couldn't make it. We do have an hour and a half, but we may, we can, it's there if we need it, but we may finish slightly earlier.
Good.
I'd also mention, my lord, that we're joined today by pupils and staff in the public gallery from Craigmount High School, so I'd extend our welcome to them today.
Indeed. Thank you. Well, good morning, Miss Hume and Mr. Clanahan, and indeed the pupils of Craigmount High School. I'm very happy to see you all here. When you're ready, Miss Hume and Mr. Clanahan, Miss van der Westhuizen will have some questions for you. When you're ready, please.
Thank you, my lord. Before we start, could I please remind you both that the proceedings are being transcribed, so if you could remember to speak slowly and clearly, just so we can get everything down, and I'll try and remember to do the same. Could I start by asking you each in turn to confirm your full name and the name of the organisation that you represent and your roles now and during the pandemic? And perhaps we can start with Ms. Hume, followed by Mr. Clanahan.
Thank you. So my name is Frances Hume. I'm the National Development Officer at Interfaith Scotland, and I was the same post during the pandemic as well.
Thank you. Mr. Clanahan.
Good morning. My name is Christopher Clanahan. My pronouns are he, him, and I am the Policy and Campaigns Officer at the Equality Network. The Equality Network is a national charity for LGBTI equality and human rights based in Scotland.
Thank you very much. You both previously attended a roundtable meeting with other members of the Human Rights Consortium Scotland and the inquiry team, and a report of that roundtable meeting has been approved. My lord, for reference, that can be found under SCI WT 0521 -000001. So the intention today is for His Lordship to hear about some of the key issues and impacts experienced by your organisations, by their members and or by the organisations that they supported during the pandemic, and by the wider communities that were supported. And this will be under a number of broad themes. Before I outline those themes, could I please ask you each to provide a brief overview of the organisations that you represent, including the usual or non-pandemic role that they fulfill, the type of work they ordinarily carry out, and the organisations and or communities that they normally support or represent. And again, if we could start perhaps with Ms. Hume, followed by Mr. Clanahan.
Thank you. Interfaith Scotland is a membership organisation of 50 member bodies from different religions, religious denominations and belief communities. It facilitates constructive dialogue and engagement between these different communities through educational activities, interfaith dialogue, civic engagement and promotion of religious equality. Our regular remit is multifaceted. I run a schools programme where we bring in people from different religions to speak to pupils in order to combat some of the negative stereotypes of different religions and cultures and promote inclusion. I also support the 20 local interfaith groups throughout Scotland. Some of these are grassroots community bodies, others are supported by local authorities, and a couple are paid interfaith groups in Glasgow and Edinburgh. We also have a youth advisory board that reports to the Scottish Government on matters of civic importance and responding to consultations. I support women of faith groups as well throughout Scotland. We have a religious leaders forum that meets biannually, and this forum brings together all the different religions of Scotland to make a difference within the community, whether it's working on anti-poverty initiatives or environmental concerns, amongst others. We have a religion and belief equality trainer who works with statutory and non-statutory agencies, providing advice on supporting the needs of people of different religions and beliefs in Scotland. We work in partnership with a number of organisations, for example, Police Scotland, NHS and BBC Scotland, and have also worked on hate crime initiatives. And one of our largest annual events is Scottish Interfaith Week, which approximately 80 organisations, faith communities, schools and local interfaith groups put on events to promote inclusion and celebrate our religious and cultural diversity.
Thank you very much. And Mr. Clanahan.
Yes, thank you. As I mentioned, the Equality Network is a national charity in Scotland working for LGBTI equality and human rights. Our work is founded on the engagement with and empowerment of diverse groups of LGBTI people across the country. And as an organisation, since 1997, we've played a key role in achieving lasting change for LGBTI people in Scotland, including the repeal of Section 28, the passing of same-sex marriage, legislation to address hate crime, and the introduction of the NHS Scotland Gender Reassignment Protocol. To achieve our impact, we take an intersectional human rights-based approach, and we put community voices at the centre of all our work and everything that we do. We do our work and achieve our impact in partnership with LGBTI community members, organisations, as well as working with the Scottish Government and other public agencies and human rights defenders here in Scotland. Internally, the Equality Network is split into several teams. Myself, I'm part of the policy team, but we also have a team working on disability, neurodiversity and inclusion. We have a training team, and we also have a community engagement and development team. Our work is primarily funded from the Scottish Government via the Equality and Human Rights Fund, which is administered by Inspiring Scotland. And during the pandemic, we were actually funded by 3 smaller grants, which were essentially assumed into the Equality and Human Rights Fund in 2021. The name of those funds were the Equality Network Intermediary Project, the Scottish Trans Alliance Intermediary Project, and the Intersex Equality Project. But as I mentioned, this was essentially formed into the Equality and Human Rights Fund in 2021. In relation to COVID-19, we have done and we continue to do a large amount of work in relation to the pandemic and the disproportionate impacts that were experienced on LGBTI people in Scotland. We no longer treat COVID work as a separate work stream, but actually that is mainstreamed across all of our work that we do now, whether that be our human rights work, our work in healthcare, or our research work. And we recently participated in this inquiry's Let's Be Heard project, providing LGBTI experiences in a report to the Let's Be Heard project, which I'd be happy to share after the session if useful.
Thank you very much. So time permitting, and I think we will have enough time, we propose to discuss issues and impacts under the following broad themes. Firstly, organisational adaptations and role during the pandemic. Secondly, impacts on individuals, relating specifically to food and other essentials. Impacts on individuals in relation to mental health, well-being and social impacts. Impacts on individuals in relation to pandemic information. Financial support. Sixthly, impacts on organisations in relation to staffing and operational matters. And seventhly, potential lessons to be learned. In relation to organisational adaptations and role during the pandemic, which is the first theme, we can perhaps start with Ms. Hume, again followed by Mr. Clanahan. We've heard a bit about your organisations and how they normally operate. Under this theme, I'd invite you to describe for His Lordship how your organisations adapted their service delivery during the pandemic and how the role changed. And it would be helpful if you could, for example, include information about changes to the ways of working, including working from home and moving to digital working, how you maintained community engagement and collaboration, partnership working, and any challenges associated with those changes and adaptations. If you need prompts, again, there was quite a lot in there, I will prompt you. But please, Ms. Hume, if we could start with you.
Thank you. We have a 7 staff team, of which 6 are working part-time. All of the staff were working from home throughout the pandemic. 2 staff members were provided with laptops because they didn't have a laptop at home. We had all our dialogue events online. We actually had quite a few more dialogue events than usual in terms of supporting people who might have been isolated. It also meant that people could join from all over Scotland and the world, whether they're from very small communities, that all could come together. We had one scheme called Interfaith Buddies, where people were teamed with somebody from a different religion and would have more quality time to find out about each other. We discovered the Scottish Government actually took that up with their staff team as well, which was lovely to hear. We really had a lot of online systems which were created during the pandemic. So, for example, using Google Drive to share files with one another, the use of Zoom for staff meetings. We had much more regular staff meetings, meeting every week, again to support each other emotionally and practically as well. We had our online calendar, and this was a way of, because a lot of what we do is community-based, it's very important to be able to have that dialogue both as a staff team and with our local communities to reduce isolation and for creativity of ideas as well. I also took part in what was a weekly meeting with the Scottish Government and faith and belief bodies. So that was to discuss the latest COVID regulations for places of worship, and we cascaded that information weekly to all our faith community bodies and local interfaith groups. And I also joined the BMIS Ethnic Minorities meetings, again, which was a regular meeting, and that way I found out more about the impact of COVID on ethnic minority communities as well. So I had that dual approach as well.
Thank you very much. Mr. Clanahan.
Thank you. I'll firstly speak to the working arrangements in our organisation before touching on how our workload changed. But in terms of the arrangements for staff, we, like many other organisations, switched to flexible working during the pandemic. Fortunately for us, we had moved most staff members over to using laptops the year before. And we had also switched our main server over to a cloud-based server, which meant that when the lockdown happened and the restrictions were put in place, staff members were able to change quite easily to working from home because of the introduction of laptops the year before. However, there were a few things that we had to change as an organisation to enable working from home to take place. One of those was we had to buy an additional laptop as our accounts was managed on a desktop in the office. We had to set up a new answer phone machine to access that digitally from home, and although staff had their own laptops, we also had to buy external monitors, desks and suitable chairs for some staff members to make working from home as comfortable as possible. In terms of the workload itself, as I mentioned, we at the Equality Network are split into various teams, and the bulk of our work, the majority of our work that we do is the policy work. And so actually that was able to continue relatively the same as it was, albeit at a little bit of a slower pace. Fortunately, our work was able to go on, and a lot of our work is meeting with MSPs and discussing policy and legislation. So instead of doing that in the Scottish Parliament building, we were doing that on Zoom instead, which was fortunate that that could continue. In terms of the things that we were working on at the time as well, things like our reproductive health work, our online survey work, that was able to continue as well. But one thing that we were working on at the time was the Hate Crime and Public Order Scotland Bill, now the Hate Crime and Public Order Scotland Act, and instead of giving evidence in person to the Equality, Human Rights and Civil Justice Committee, we gave evidence online for that instead. And I spoke to colleagues at the time who were working, and they said that that work was still continuing at normal, albeit a little bit slower. The main area of work that I would say that probably changed for us was our community engagement and development work. So as well as engaging with individual members of the LGBTI community in Scotland, our community engagement officer also develops LGBTI groups in Scotland. And pre-pandemic, that involved travelling around Scotland, visiting groups in person, supporting them, building their capacity. And so when the restrictions were put in place and lockdown happened, we had to spend quite a bit of time at the beginning to figure out how we would still be able to support different LGBTI groups across the country in the same way. And as no surprise, most of that was taking place online on platforms like Zoom, Microsoft Teams, and so forth. We did actually receive additional funding to support this community engagement work and the adaptation to working online, and I'll be happy to provide more information on that later on when we discuss financial assistance and funding. Thank you.
Thank you very much. The next topic I have relates to impacts on individuals, in particular in relation to food and other essentials. And if I could ask Mr. Clanahan to start off on this one, followed by Ms. Hume, and if you could include, for example, issues related to the need for support in relation to food and other essentials and the reasons why, or some of the reasons why there might have been an increase in need for that support. Physical restrictions on access to food and other essentials, digital inclusion issues, possibly particular issues for those in the shielding group, if applicable to those you support, cultural and religious considerations in the provision of food support, disproportionate impacts on any particular groups of people, the types of support provided by your organisation or by the organisations they supported, or any other relevant key issues under this topic. So, Mr. Clanahan.
Thank you. The people that we have engaged with so far in terms of LGBTI community members in both our research and through our community engagement has found that LGBTI people, or a large proportion of LGBTI people that we spoke to, had difficulty accessing essential items. That includes things like food and other essential services. And there's a few drivers for this. But I think some of the main reasons that we've seen during COVID was, first of all, poverty, and second of all, just general financial instability. In terms of poverty, LGBTI people are more likely to live in poverty in Scotland, and in fact 27% of lesbian, gay and bisexual people live in poverty compared to 20% of their heterosexual counterparts, and that is figures that was brought out in 2023 by the Equality and Human Rights Commission Scotland. But that situation, I would say that the pandemic exacerbated this for a lot of LGBTI people, and that only made it harder to access additional items and the essential services that they needed. We also conducted, as I mentioned, our Let's Be Heard report, and in that report participants told us that they faced increased financial instability, increased pressure on their financial situations, which had an impact on them accessing food and essential items like grocery shopping. One participant told us that they had difficulty covering basic expenses, including rent and utilities, which sometimes meant choosing between essentials like food, heating and housing. Unfortunately, that same participant told us that that was something that they would never forget, and that was something that had left a mental scar on them. In terms of accessing support, the LGBTI people that we spoke to had said that, or that the experience was mixed. Some people were able to access support, and some people did not access financial support for essential items. Of the people that we spoke to who did access financial support, they told us that this was very helpful, but actually the process of getting that financial support was very difficult and complex. One of our participants told us that due to the high demand, the application process was lengthy and complex and very difficult to understand. Another thing that came through in our engagement with the community was a particular difficulty for pregnant women at the time who were relying on food banks. They told us that the food banks were very helpful and supportive, but that it was very challenging to access them regularly with the restrictions, especially during lockdowns and when they had to keep up their required diet to keep their mother and baby healthy. We also heard from the same group of people that pregnant women were disproportionately impacted by digital poverty, which meant that they were unable to access certain information about accessing financial assistance and essential items, which that digital poverty compounded that experience. Thank you.
Thank you very much. Ms. Hume.
Thank you. Through our work at Interfaith Scotland, we had one major change within my role, which was managing a local community resilience fund, which we had £25,000 for the first set of funding. And I'm mentioning that at this stage because through people applying for that fund, we found out in more depth what some of the issues were that people were facing. So I'll mention more about the fund later on, but just to mention a few of those things now. There were Indian students who were struggling with being able to feed themselves, so they were looking for food aid. It was also mentioned about single, destitute asylum seeker men, asylum seekers and others waiting for benefits, those who had lost their jobs. So I'll give an example from Project Bridging the Gap. One of their staff members who lives locally met a woman with 6 children whose husband had just lost his job due to COVID and had not yet received any welfare benefits and was struggling to feed her children. And so they were able to buy nappies and wipes for the family and support them in their shopping. Through attending meetings with BMIS for minority ethnic communities, we heard about how people were adversely affected. This included things like language barriers, then reading materials. Some were less likely to access vaccines due to suspicion of government from perhaps the countries that they were from, where they had escaped from. There's a piece of research which has just come out called Racism, Belonging and COVID's Legacy of Ethnic Inequalities in Scotland, and that highlights the fact that there was a higher risk of death of someone close to you, and that is 68% for other ethnic groups, 44% for Indian nationality and 38% for Pakistani nationality compared to the 25% of national average. So this can lead to higher levels of bereavement, financial demands and caring responsibility. One practical issue in relation to food support is the provision of food for culturally and specific religious needs as well, and whether that could be provided or not.
Thank you very much. The next theme is impacts on individuals in relation to mental health and well-being and social impacts. And if we could perhaps start with you, Ms. Hume, this time, followed by Mr. Clanahan, and if you could touch on, if applicable, impacts on mental health and well-being, issues around loneliness and isolation, digital inclusion issues, access to support services, disproportionate impacts on any particular groups of people in relation to this, and the types of support provided by your organisation or by the organisations that it in turn supported, or any other relevant key issues relating to mental health and well-being and social impacts.
Thank you. Again, I'll be referring to the funding that we were providing, which gave us a greater insight to what the needs were at that time. Particularly for those who were elderly in religious congregations. They might not have been able to access the internet, which would make them disproportionately affected, for example, if services went online, which can lead to greater loneliness and isolation. Perhaps they might not have the mobile phones or iPads or computers in order to be able to access these. Also, in terms of information, they might not see online information as well that could support their mental health and well-being.
So could I ask you just to speak a little bit louder? I suspect
sorry.
you might be struggling. They might be struggling to pick you up.
Thank you. Shall I repeat what I was saying?
No, I think we probably caught that. Was there anything else in relation to mental health and well-being that you wanted to add? Oh, thank you. Mr. Clanahan?
Thank you. Almost everyone that we heard from the LGBTI community told us that they had faced some form of social isolation in one way or another, which had a negative impact on their mental health and well-being. We had community members who told us that during the pandemic they had lost friends because they were not able to meet up in person with them, and they had difficulty maintaining friendships on different platforms like WhatsApp, for example, where communication was different than it would be in person. We also heard from community members that there were concerns for older people, older members of the LGBTI community, particularly in rural locations where they may not have a digital connection or access to friends, other LGBTI friends who were living in urban areas. One thing that came through strongly for us in speaking to the participants, and one of the causes of social isolation, was the potential to have unsupportive family members. And by unsupportive, I mean family members who did not accept or support an individual's sexual orientation or gender identity. And of course, this had a very negative impact on individuals who experienced that. The Scottish Government, in their messaging and their guidelines, made the assumption that everybody would have a traditional, stereotypical family unit, and this is a very heteronormative view, and in fact, for a lot of LGBTI people in Scotland, that's unfortunately not the case, and so that contributed to the social isolation that they were feeling. We also heard, unfortunately, from other community members that they faced social isolation and they were not able to access essential services because they were forced to stay at home with someone who was abusing them. And these survivors of domestic abuse recounted to us the horrendous situations in which they in which they stayed during the pandemic. We had someone who told us that they were prevented from accessing services. They were cut off from other people. They had undergone forced servitude, and they thought that they would not live through the pandemic. And I think the mental health and well-being impact of that probably speaks for itself. Another thing that we've seen for LGBTI people facing social isolation was the loss of in-person LGBT pride events that take place across Scotland. These events are not just a day out, they are a chance for the LGBTI community to really come together, to connect, to reflect on progress, and to demonstrate for ongoing equality issues in Scotland. And the community really felt the impact of that not being the case during the pandemic with the restrictions. Some prides were fortunately able to take place online, albeit in a very different setting and a different atmosphere to what would normally take place at an in-person pride in Scotland. And this particularly highlighted a lack of visibility for LGBTI people, particularly in rural areas. In terms of the digital inclusion aspect of that, we heard from individuals who told us that they had a positive experience with digital inclusion, which contributed to some of the negative experiences of social isolation that they were feeling. One thing that did impact this was for people who had existing access to technology. Those individuals were able to stay more connected with other community members. We had people tell us that they were able to continue university online and able to meet with classmates online, which contributed to negating some of the social isolation and mental health impacts of the pandemic. One thing that almost all of the people we spoke to said that where they were able to access LGBTI safe spaces online, LGBTI community groups, those individuals had a positive experience of digital inclusion, and that really contributed to, as I said, negating some of the impacts of social isolation and the negative impacts on mental health and well-being. We had a community member tell us that actually this provided a sense of connection and understanding and reduced the isolation that I was feeling. In terms of digital inclusion and the opposite as a negative experience, as I've mentioned, we've seen that a lot of LGBTI pregnant women were facing digital poverty, and that had an impact on the connections that they were able to make, the information they were able to access, and that contributed to the social isolation and negative mental health impacts that they were facing. I can definitely say more about what the Equality Network did in terms of trying to combat some of that social isolation and some steps that the Scottish Government took as well with funding, but I'd be happy to elaborate on that later during our financial support section.
Okay, well, thank you very much. Well, before we move on to the next topic, could I just ask you both, and you may not be able to answer this, but are there, or to what extent are there ongoing impacts, mental health and wellbeing impacts and or social impacts, some of the negative ones that you described amongst the communities that you support? Are those ongoing, or are you not able to contribute in relation to that?
I wouldn't be able to contribute on that at this stage. In terms of our work, everything is returned to in person, so that has been supportive for communities and reducing isolation, but we also continue to have online engagement as well for those who may continue to be isolated.
Thank you. And Mr. Clanaghan?
Yes, in terms of the ongoing impacts of the pandemic, there is definitely the experience of people that we have spoke to is varied. Some people have found a lasting impact on themselves. For example, I previously mentioned that one community member told us this had left a mental scar on them that wouldn't go away. So we definitely know that there are some people still experiencing negative aspects of the pandemic. I wouldn't be able to generalise because everybody is different. We're not one homogeneous group. However, what I would say is that we have seen, in terms of the events that we are doing and from an accessibility perspective, we are running more things online now, and we've heard from people that increases the accessibility of accessing LGBTI spaces, particularly for disabled members of the community. So whilst I can't say that I can't speak for everyone in the community, I can definitely say that there's been some positive impacts that are ongoing now as a result of the pandemic that have changed some of the ways that people are engaging on the ground, but also some of the ways that we are engaging as an organisation.
Thank you very much. The next and fourth topic relates to impacts on individuals, specifically relating to pandemic information. And if we could perhaps start with Mr. Clanaghan this time, followed by Ms. Hume, and if you could cover, where applicable, for example, digital inclusion and access to information, and this is pandemic information, timing of that information, clarity and complexity of information, any particular language issues, disproportionate impacts on any particular groups of people in relation to pandemic information, and the role of your organisation or the organisations it supported in disseminating information and providing related support, and any other relevant key issues relating to pandemic information. When I talk about pandemic information, I'm talking about sort of information about particular rules and guidance in relation to that. And more generally just about the spread of the virus and information that's available to individuals.
Thank you. I would say that one thing that came through very strongly for us and the people that we engaged with was, as I've mentioned, there was an assumption by the Scottish Government of very stereotypical heteronormative family units. And we actually conducted a piece of research called our Further Out report, which examined and heard from LGBTI people living in rural areas. And that report told us that the rules, guidelines and messaging around support networks felt as though they were built around stereotypical heteronormative family. Participants told us that they felt as though the government and media messaging suggesting that a person might rely on a neighbour if they were to be housebound due to COVID, or advising people to stay home with family members, did not understand the non-heteronormative relationships, family structures, carer responsibilities and different kinship groups that LGBTI people might have. We also heard from one participant in that report who was living in a rural location just outside of Glasgow that she felt like banging her head off of a wall, trying to comprehend how she would cope without the support networks that the Scottish Government had assumed. She would like to see more thought given to LGBTI people who live on their own about how they might manage this. So I think in terms of the information that was available for the pandemic, that was given in one format, in one way. And I think learnings for future would be not to do that, not just for the LGBTI community, but that would also benefit the general population more broadly, from people who are maybe estranged from family members, who have been able to escape domestic abuse settings, and I think that that's something that we could really take forward. In terms of pandemic information more generally, and adding an intersectional lens to this, we heard from disabled members of the community or members of the community who were living with a disabled family member at the time, who told us that there was a real lack of information for people with disabilities. And actually, contacting the social care department was very difficult. It caused a big disruption and resulted in much more stress on the family as a whole, and made their quality of life even harder to look after the family member. So I think it's clear to us that there were various barriers for LGBTI people when accessing pandemic information. And of course, people who were experiencing digital poverty would have again been disproportionately impacted by that. Thank you.
Thank you. Ms. Hume.
Thank you. I've already spoken in terms of language issues for people who need translation of various online and paper resources. As Christopher's mentioned, in terms of the digital exclusion, particularly for the elderly, in terms of not receiving online information. I mentioned already that we attended the meeting for religious and belief groups every week with the Scottish Government. I have to say I was pretty impressed in terms of the information that was shared every single week, because in a continuously changing environment, information on places of worship, whether they could be open and how many people could attend, was constantly changing. So from that point of view, we heard very quickly about these changes. Some faith communities said maybe not quickly enough if they heard midweek and then they had to cancel a service or something like that. So, but that was quite difficult to achieve when things were changing on a daily basis. In terms of our role as an organisation, as soon as we received any updates, we would disseminate this via email and e-newsletter with to all our major faith communities. As I mentioned, there are 50 bodies, both of religious groups and local interfaith groups, who would disseminate at a local area to the different faith communities that were engaged with those groups. And so we thought that was a really important way to continue to keep people in the loop. We also have an annual public lecture, which was given by Jason Leach, who was our keynote speaker at that. And again, he was able to share the continued medical issues and ways of staying safe during the pandemic.
Thank you very much. Unless there's anything to add on that topic, the next topic is financial support, and I'd invite you both to describe for His Lordship the key issues and impacts relating to financial support, to include, for example, funding available to your organisations to deliver welfare assistance and support, the distribution of funds to other organisations, the accessibility of funds, the time taken to receive funds and any issues around that, the communication and advertisement of funds by the Scottish Government and funders. If either of you can speak about the Connecting Scotland programme, financial support for business administration and operations of organisations, i.e. your own organisations and those you support, extension of core funding and any other relevant key issues. And if we could perhaps start with Ms. Hume, followed by Mr. Clanahan on this one.
Thank you very much. I mentioned that we received £25,000 in funding for both faith communities and local interfaith groups, of which £500 was available per group. And they did not need to register as a charity to be able to apply for funding, which was very helpful for local community groups that didn't have a constitution. This was very quickly delivered in terms of the funding was open between April and June, and it was my role to administer this fund, which was the first time doing anything of this regard. So that was a learning process, and obviously took extra work for our financial manager as well, but we were able to deliver that. The first round of funding, we had 69 applications and were able to fund 67 of that. So we had, this included Hindu communities, Muslim, Jewish, variety of different Christian denominations, Buddhist, Sikh and Baha'i communities, and local interfaith groups in Edinburgh, Glasgow, Fife, Aberdeen, Skye and East Renfrewshire all were able to distribute welfare and assistance. And so I'm going to mention a few of these and give some examples as well. So in order to overcome social isolation, particularly churches, Buddhist places of worship, mosques and Jewish communities organised online services, either live streamed or Zoom, whether it's Christian worship or meditation, and that supported those who were able to access this. For those who were not able to access online services, these were printed and posted, and DVDs were sometimes made of services and posted or delivered by volunteers, and youth groups and community groups continued to meet online as well. So another example from Glasgow Jewish Representative Council and the Scottish Council of Jewish Communities. They held large events. So again, we were able to fund Zoom, a higher Zoom for people to attend. So 650 people registered for a klezmer concert, 300 people came to a prayer service for people suffering from the pandemic. Local interfaith groups were very much able to support local communities through food aid and also top up for people's mobile phones so they could stay in contact with family and friends, particularly those separated from those during the pandemic. They were also involved in projects sewing masks for people. East Renfrewshire Faith Forum had volunteers sewing masks. Edinburgh Women's Interfaith Group provided 100 masks for Edinburgh Sick Children's Hospital. Varapunya Meditation Centre provided 400 face masks from overseas. A lot of practical aid as well, and I'm just taking a few examples. So the Al Care Foundation, which is a Muslim charity, provided food packages for the homeless, those shielding, those waiting for benefits, those who'd lost their jobs, and European families who were told they were not entitled to benefits. I mentioned earlier that Indian students and the Hindu temples in Scotland provided rice, wheat and lentils for them. Save Us Scotland, which is a Sikh organisation, distributed an amazing 100,000 food packages. And to mention that as well, that they were culturally and religiously appropriate and provided things, for example, during festivals of Easter eggs, so that people would feel personally supported and included. Another Roman Catholic Church charity provided essentials, so for example toiletries, laundry supplies, purchased cooking pots to make hot food for 70 people every week. Another Catholic church assisted the homeless living in hotels where all food had to be brought in ready-made, and also helping with prescriptions and delivery of medications as well. Another Sikh charity, Sikh Sanjog, also provided culturally specific food and kept their telephone lines open, receiving 300 calls which could support people with food provision, benefit support, family support, domestic violence, employment, immigration, housing, relationship and mental health advice, amongst other things. And I already mentioned Bridging the Gap project supporting destitute asylum seekers as well. The second fund that we received was for the second lockdown, which took place in the autumn of 2020. So this fund was provided in October. Again, it was £25,000 up to £500 per group, whether it's place of worship or a local interfaith group. And that was to support places of worship to reopen safely and support people as well who were too vulnerable to come back to their place of worship, including things such as mobile devices and telephone calls and mail-outs. So again, we had a lot of applications. We had 58 applications and 56 were funded. And again, throughout all the different faiths, Hindu, Muslim, Jewish, Christian, Buddhist and Sikh. And the report that we had back was that this really helped with people's emotional and mental health. For example, the Varapunya Meditation Centre in Aberdeen had daily live broadcasts of talks, chanting and meditation, and the feedback was it helped people overcome anxiety, isolation, PTSD, and through having almost died in hospital, supported them to come back to emotional health as well. And in terms of places of worship, many places of worship were able to reopen safely, being supplied with PPE, face masks, face shields, sanitizer, and track and trace facilities, and also showing and guiding people where to go so they could stay meters apart and that sort of thing as well. And leaflets were continued to be distributed, and funding for things like Christmas cards and services and places of worship, so that those who were still isolated could continue to feel included in their place of worship.
Thank you. Before we come on to Mr. Clanahan, I just want to ask, you mentioned, for example, during the first lockdown, I think funding being provided for example, face masks and food packaging, and then the second lockdown, you mentioned various, including, for example, daily talks. We've heard a fair bit about third sectors, organisations pivoting and doing things that they wouldn't ordinarily do. To what extent were they applying for funding to fill gaps that they saw, versus the Scottish Government approaching them and asking them to fulfil roles that they wouldn't ordinarily fulfil? having seen the gaps themselves? It may be difficult to ask.
Yes, I'm going to answer your question, but I'm not sure if it's exactly what you're specifically looking for. But what happened is we liaised with the Scottish Government at the start, looking at what the potential issues might be for these different faith communities, and then we had an approach where we had a list of things that we thought could support them. So these included setting up the professional Zoom accounts for faith communities to continue to lead their worship, providing food for those isolated, phoning lonely people in the community, printing the leaflets for those to feel included, and working in partnership with others to support individuals and communities to alleviate physical and emotional stress. So between liaising with Scottish Government and Interfaith Scotland, when we sent out the funding application, those were the examples that were given, but people could also respond and explain within their faith communities what they might need as well, and that would have been included and considered within their funding application.
That's helpful, thank you. Mr. Clanahan.
Thank you. In terms of financial support, I will split this into two in terms of the funding that we receive to distribute to other organisations, and then also I'm happy to speak on our core funding during that time. To begin with the funding for other organisations, we accessed 3 different funds. The first of those, which was very early on in the pandemic, was a resilience fund from the Scottish Government to help third sector organisations struggling with COVID-19 and who were impacted financially. We applied for a grant of about £5,000, which we got within 3 weeks, and that enabled us to provide free Zoom licences to LGBTI groups across the country, and we were able to supply approximately 30 licences. And this was able to help LGBTI people to get online, to connect and reduce social isolation. One thing that we also did at the Equality Network was run Zoom training sessions to train other groups how to use Zoom and to manage their meetings online. The second fund that we accessed from the Scottish Government, which was significantly larger, was the Supporting Communities Fund, which was set up for investment in local responses to the pandemic, and we were one of 373 organisations that received money from that fund. We actually applied with other LGBT organisations in the sector in Scotland for a joint bid of £87,700, which we got at the beginning of July 2020, and that money was to be used by the end of 2020 as well. And we dispersed a lot of that money to different LGBTI groups to organise online meetings, specific COVID-related work, but the main breakdown of what that money was spent on our end from the LGBT organisations was an LGBTI microsite, an information site. We spent a significant amount on cultural activities and LGBTI prides to ensure that groups could set up Pride online and people could still attend that and have the capacity as well actually to run a Pride online, which is vastly different from the in-person parades and marches that we would normally have. We distributed a large amount to different LGBTI groups, LGBTI individuals, LGBTI sports groups, LGBTI asylum projects, LGBTI youth, and there were some admin costs as well for the organisations who were distributing those funds. It was actually felt by the organisation that the Scottish Government had acted quite well and quite quickly with that, and actually the funding application was a lot quicker than it normally is, and it wasn't as long as it normally is either. I think the application page was about 4 pages, which we didn't have to evidence with lots and lots of research that we normally would in a funding application, just given the nature of the pandemic and the timing of the emergency. So it was felt that that was actually a very positive thing that the government did that enabled local action quite quickly. Another fund that we accessed in 2021 was the Community Recovery Fund, and this was to support communities and people as we moved into recovery as a country. And we applied to that fund on our own and received £44,000, which we then dispersed to other LGBTI groups across the country to support their recovery and transition into a recovery period. In terms of our core funding, as I mentioned at the beginning, our core funding comes from the Equality and Human Rights Fund, which was established in 2021, and prior to that was 3 separate smaller grants. And actually, our funding was due to run out at the end of September 2020. However, right at the beginning of the pandemic, in March 2020, the Scottish Government told the recipients of the equality grants that anyone receiving those funds would be extended by another 12 months at the same rate. So our core funding was actually extended. And this meant that at the beginning of April 2020, we knew that we would be funded to September 2021. And that meant that our CEO at the time could then tell staff that their job was secure until the end of September 21, which during a time of mass uncertainty, national uncertainty, this was a very positive step that the government did and enabled us to relay that information to staff. Then, of course, there was the Equality and Human Rights Fund in February 2021, and organisations were invited to submit applications to that, which we did, and we've been funded by the Equality and Human Rights Fund ever since. One thing that I would say as well about our core funding was that I mentioned at the beginning we had to provide monitors, desks and chairs, etc. There wasn't additional money made available for this, but because we were underspending on our grant, we had money available to equip staff with that. So that money came from our core funding, but I'm not aware of additional funds that were available to support staff to work at home in that way. Thank you.
Thank you very much. Moving on to the next theme, and speaking of staff, the next theme is impacts on organisations, in particular in relation to staffing and operational matters, including, for example, increased workloads, impacts on work-life balance, welfare and well-being, including isolation, support for key workers, any ongoing impacts and any other relevant key issues relating to impacts on your organisations. And perhaps we can start, well, we'll give you a break, Mr. Clanahan. Start with Ms. Hume and then followed by you.
Thank you very much. In terms of workload, I could say this became more complex in terms of my own role. I hadn't managed a fund before for external groups and organisations, and that was 123 projects supported in total throughout from April 2020 up until December 2020. So this was a learning curve for myself, but I think I managed to rise to the challenge. And of course, there's an anxiety around in terms of food aid, making sure that you were able to get that financial support out as soon as humanly possible. And we were lucky that almost all those who applied did get the aid. It just seemed to marry up beautifully in terms of how many people applied and how many people received aid. In terms of working together on Zoom, that was extremely positive for us as a staff team because it meant we could continue to meet together, plan events with one another and keep all our core work continued throughout that process. As I mentioned before, all our dialogues were online, and we also had extra events as well. Although we didn't have increased hours, we managed that within our staff time. One big difference is my remit is all across Scotland, so you can imagine if I'm having events in Aberdeen or Inverness, for example, working in Glasgow, you'd have that huge travel time. backwards and forwards for meeting. So the fact that we were able to have all those meetings on Zoom actually created more available time to have events because it wasn't taken up with travel. This is something that's continued while we do have in-person events. Sometimes our planning meetings will be online to avoid excess staff travel time. So there's more time and energy to do other things as well. During the pandemic, we were very much supported by our board and director. So, for example, we were posted out care packages on a regular basis. One anecdotal thing to mention is we had our Christmas dinner from home. We were actually sent a 3-course dinner to our houses, and we had an online meeting, an event where we all had our dinner together, and we had games, and which is something I normally organise anyway. So really the staff are really supported. For myself, the isolation was particularly as a single person living alone, and one thing that I have actually found a little bit disappointing is that we have a hybrid system now, which seems to work for the majority of staff members, but for myself, I feel that more in-person staff engagements support would be more supportive for my own mental health. And in terms of meeting in person, I think that really supports the creativity and collaboration of ideas, as we have an open plan office. So when we're all in together, I find it's a more creative process. But we do have 2 days where we all try to come in a week as a staff team, so we can continue with that. And as I mentioned, in terms of online meetings, it does mean that there's not so much travel time. So what we found, there's been pros and cons, and in some ways it's great that we've been able to continue with online events as well as in-person ones, which we found with our Interfaith Week. We have 80 events, and it means that people can travel or not travel according to what their needs are. And also works for us as well. So, for example, during Interfaith Week, I had an event for teachers. We've just published a new resource on supporting the needs of people of different religions and beliefs. So we had 30 teachers sign up from all over Scotland. So that's something that I would not personally have been able to get to myself.
Thank you very much. Mr. Clanahan.
Thank you. In terms of the impact of flexible working on staff members, a minority of staff said that they were finding it difficult to work at home during the pandemic, but it was felt by the majority of staff at the time that most people enjoyed working from home. So there was variable experiences within the organisation. For the minority who were finding it difficult to work at home under the restrictions and lockdown, the organisation collectively did a few things to try and mitigate that. Of course, all of our team meetings were now taking place online, but we also had additional meetings called a water cooler meeting, where we would meet to just have a friendly chat and a friendly catch up and try and reduce some of the isolation that some staff members were feeling from working from home. One thing that's really positive that's continued today actually is LGBTI organisations in Scotland during the pandemic decided to create a shared channel to stay in touch during the pandemic, to be friendly, and now that's something that has continued on now that the restrictions have been lifted, and we use that for sharing updates, information sharing, collaboration, and it's really positive. It's something that I really like, and it's something I noticed when I came to the work at the Equality Network, was that genuine connection between other organisations that was born during the keeping up to date with each other during the pandemic. In terms of staff turnover, our staff turnover wasn't very different from what it would normally be. We didn't see a massive increase or a massive decrease. It was just pretty standard for us. In terms of the workload, it predominantly stayed the same. As I mentioned, a lot of our policy work was taking place, but albeit at a slower pace. But where we did see the workload changing was in relation to our community engagement and community development. There was although the individual was not travelling around Scotland to support groups, they were then doing that online, which meant that they were saving significant travel time from travelling across the country. But this was offset by having the additional workload of distributing Scottish Government funding to different communities. And so the workload probably balanced itself out, but it definitely did change during the pandemic. Our finance officer as well, I would say that their workload increased during the pandemic because they were keeping additional records of all the fund money that we had received, and then the fund money that was distributed as well. So that was an increased job for them. Thank you.
Thank you. Before we turn to our final theme, which is potential lessons to be learned, I'd just like to give you the opportunity. We obviously have the roundtable report, which will be taken into account, but just to give you both the opportunity to just highlight if there are any other key issues or impacts either on your organisations or on the organisations you support or the wider communities that we've not touched on today that you want to just highlight or flag to His Lordship, failing which we can move on to lessons learned. But I'll give you each that opportunity now. Perhaps we can start with Ms. Hume and then Mr. Clanahan.
As has just been mentioned, another result for us is continued membership of the Religion and Belief Representatives Group, which was started during the pandemic. So while it was on a weekly basis, now we meet every 2 to 3 months. That's been a very positive outcome. We actually had organised a conference as a group, and which took place in October. And it's a way of continuing that relationship between the Scottish Government and religion and belief communities that are represented on that group, particularly in terms of consultations and issues that come up for faith communities. And the same with the meetings for minority ethnic groups organised by BEMIS. Again, it's a great opportunity to continue that relationship and also for ourselves to act as a conduit for disseminating information through our emails and e-newsletter, which we continue to do on a 4 to 6 weekly basis to all our communities. So that's created a stronger channel of communication, I would say.
Thank you. Mr. Clanahan, anything else that you'd like to add in relation to impacts?
Thank you. Yes, there's 2 things that I would like to add. The first of those is in relation to healthcare. When we conducted our Let's Be Heard engagement and Let's Be Heard report for the inquiry, we found that participants detailed how during the pandemic there was a lack of access to healthcare broadly, but a lack of access specifically to LGBTI inclusive healthcare, which impacted their experience of the pandemic. And it was highlighted that some people felt there was a disregard for LGBTI identities more broadly in a healthcare setting, but we also heard, as I've touched upon, from pregnant women who were LGBTI who faced digital poverty, and their pregnancy was impacted during COVID by a lack of access to healthcare and other useful information during pregnancy. Another thing that came through for us was the Equality Network conducted a report called the Further Out Report that I think I've mentioned today, which touches upon rural experiences of LGBTI people. During the pandemic, that we found that those experiences, some experiences came forward that people were facing negative attitudes in more rural locations in relation to their sexual orientation or gender identity, that they maybe wouldn't have pre-pandemic, or if there was more in-person things taking place with free travel across the country as opposed to being restricted to one local authority or one rural area. Thanks.
Thank you very much. So then if we can move on to the final theme, based on the experiences of your organisations during the pandemic, I'd invite you now to provide suggestions to His Lordship for what the Scottish Government could do to mitigate the ongoing impacts of the strategic response to the pandemic, or could do differently to improve matters in the event of another pandemic or similar emergency. And perhaps we can start with Mr. Clanahan and followed by Ms. Hume.
Thank you. I think just to make a general point, before discussing some improvements for LGBTI people is that whilst we really welcome the COVID inquiry and whilst we really welcome consultation with the LGBTI community, and that's something that we always advocate for, and COVID is no different to that. But we've seen LGBTI people provide experiences, evidence, time and time again, and the inquiry is no different to that. And what we would really like to see from the Scottish Government is the next step, which is the action part of that. We've put into the inquiry, we've conducted the Let's Be Heard project, we've provided information to the Scottish Government on numerous occasions, and I think, although not in a national emergency at the moment, if there ever was one again in future, hopefully not, but if there was, taking action upon that, and we would understand, or we would know from this engagement, the disproportionate impacts on communities, but because we've also engaged with communities, we would know how to mitigate that and make that better. So I would really like to see this process and other aspects of the inquiry, that information not just be stored in a file or put in a shelf, but actually be put to some really good use by the government. Just to touch on LGBTI people more specifically, one of the things that I think the Scottish Government could do better in future is the variety of relaying pandemic information in terms of rules and guidance and the support structures that the Scottish Government may have assumed. As I've mentioned, a lot of community members told us that there was an assumption of family or supportive neighbours, which for a lot of LGBTI people, it might not only be the reality, but that might actually put them in danger if they are living with unsupportive family or neighbours. And so that's not always a possibility for LGBTI people. And I think from us, we would like to see more consideration given to that in future, not just to the benefit of LGBTI people, but other people in the general population as well who are maybe estranged from family or are survivors of domestic abuse or hate crime. I guess a positive thing that we would say, and something I think that the Scottish Government did quite well, was at the initial stages of the pandemic, when I spoke through some of the financial information and support that was offered to organisations, it was felt by us that the Scottish Government did that quite well, quite fast. The application process wasn't as long as it normally needed to be, and actually that's what was really needed at the time of the emergency, to start to support local action to combat these challenges that communities were facing. And I think that that's definitely something that the Scottish Government should do in future with the same speed and efficiency to support local-led solutions. Thank you.
Thank you very much. Ms. Hume.
Yes, I would say similarly, as I'd mentioned before, the speed of response of the Scottish Government meant that communities could be supported on a very quick basis. And as I mentioned, that they didn't need to be a registered charity to apply for funding. So some of our local interfaith groups weren't registered as charities, and they could support on a very community-led basis for their communities locally. I think that's important to support the grassroots organisations through trusted national organisations such as ourselves. As I mentioned, we have 50 religious denominations, so that is a huge amount of different religious communities which we have an ongoing and quite close relationship with, so that helped with the speed of things. The only thing I would say is, and I'm not sure what the answer is on this, but we don't represent every single faith community denomination. So for example, we don't have membership from some of the evangelical churches such as the Baptist Church, and so I don't know if they would have heard through other areas. So there's advantages of using a national organisation to get information out quickly, but also does that mean that some groups might be excluded because there isn't a directory of all religious groups and places of worship in Scotland at this present time. So it has positive and perhaps negative results as well. But I would say for the future, continue to work through these national organisations that have that immediate link in with the grassroots, but also to look more widely at where the gaps might be as well, and contact those communities directly.
Thank you both very much. My Lord, I don't have any further questions unless your Lordship does.
No, thank you. All that remains for me to do is to thank both participants for their attendance here today, and we will return at, let me get this right, 11:45.
11:45, my Lord, yes.
Thank you very much. That's all.
Thank you. No, my lord.
Yes, good morning again, Ms van der Vesthuizen. A single person witness this morning again?
A single person witness, my lord. The next witness is Miss Bronagh Andrew, who is the operations manager for the Trafficking Awareness Raising Alliance, or TARA as I'll be referring to it through the evidence, and Roots Out.
Very good. Good morning, Miss Andrews.
Good morning.
Andrew, I beg your pardon. Right, you're going to be asked some questions, so when you're ready, please, Miss van der Vesthuizen.
Thank you, my lord. Ms. Andrew, just to remind you again that the proceedings are being recorded and transcribed, so if I could ask you to speak slowly and clearly, and I'll try to do the same. Could I please ask you to start by confirming your name?
My name is Bronagh Andrew.
Thank you. You have provided 2 witness statements to the inquiry, one in respect of Roots Out and one in respect of TARA, is that correct?
That's correct.
My lord, for reference, the Roots Out one can be found at reference SCI WT-0337-000001, and the witness statement in relation to TARA can be found using reference SCI WT-0337-000002. And Ms. Andrew, TARA and Roots Out have also provided a joint response to a Rule 8 request for the by the inquiry, is that correct?
That's correct.
And my lord, the reference for that is SCI TARAXX dash 000003. Ms. Andrew, as you're aware, in the time available, we won't be able to cover all of the impacts and issues discussed in your witness statement and the Rule 8 response, but the aim is to really hear about some of the key ones. The matters that we don't have time to cover today will, however, nevertheless be taken into account by the inquiry. If we could perhaps start by discussing your role. In your witness statements, you are described as currently being the operations manager for TARA and for Roots Out. Is that one role or 2?
It's a single role that has oversight and responsibility for 2 services. We would describe the 2 services as sister services.
Thank you. And for how long have you held that role?
I've held that role since with TARA for a long time, over 10 years, and for Roots Out since 2021.
So during the pandemic, you took over that role for that. I'll be asking you in a moment to provide an overview of the work that TARA and Roots Out does. But in general terms, what is your role as operations manager for each, or for those entail?
So my role is to hold oversight of day-to-day services and provide guidance and support to 2 service managers. In addition to that role, I also have the policy lead for the issue, and I support the team to respond to various consultations, policy developments, legal consultations, that kind of thing.
Thank you. We'll come on shortly to discuss the roles of TARA and Roots Out during the pandemic. But I'd first like to ask you just about the key services that they each normally provide, in other words, in non-pandemic times. If we could perhaps start with TARA, and if you could please give His Lordship an overview of TARA, including the groups or individuals it supports and some of the key services that it normally provides, i.e. in non-pandemic times.
So the TARA service has been in operation and providing support specifically to women trafficked to Scotland to meet the demands of the commercial sex industry. We've been providing that service since 2005, and originally we were funded by the Scottish Government to support women within Glasgow, but in 2008 the Scottish Government extended our funding to support women identified across Scotland, and they also funded our colleagues in Migrant Help to provide support to all other adult potential victims of trafficking. TARA operates a 24/7 response where we can provide emergency access to accommodation and support for very vulnerable women, and we will work with women providing that emergency response, safe and secure accommodation, support, financial support with day-to-day living. We'll ensure women get access to legal advice, they see a doctor. In some instances, we'll support women to report to Police Scotland if that's what they wish to do. And then we'll work with women on a one-to-one basis to establish what we call a recovery plan, but really to work out what their goals and ambitions are. And we'll support them to work towards that, improving their feelings of safety, of independence, personal responsibility. We'll work with women for 12 to 18 months on average, but we'll support women for as long as we assess that there's a need for our service to support them to move forward and recover from their experience of being trafficked, which is a significant human rights abuse.
Thank you.
That's a very brief summary of the work that the team do.
Thank you very much. Well, we'll come on in due course to discuss the work during the pandemic, and you can also elaborate and on some of the work that continued or expanded at that time. If we could perhaps then get an overview of Roots Out, including the groups or individuals that it supports and some of the key services that it normally provides, please.
So Roots Out provides specialist support to women selling or exchanging sex in Glasgow. Glasgow as the city for a very long time now has provided a specialist response to women in particular caught up in systems of prostitution. So since 1989, the city's had some kind of dedicated service for those women in one form or another. That has evolved and grown into the Roots Out service. So Roots Out will work with women 16 and over who are selling or exchanging sex within Glasgow. That support takes two forms. There is an evening outreach service where 4 nights a week a dedicated team of staff will go out and proactively provide an outreach service to women selling sex on street in the city. That includes access to things like needle exchanges, condoms, harm reduction, but they'll also act as a bridge for those women into Roots Out's case management service, who will provide holistic support to women in the city. It includes help supporting them to access homeless services, addiction services. They'll provide women with lots of support around their interface with social services within the city. And of course, if women wish to do so, that team will work with those women to support them to exit prostitution. About 3/4 of the women they support have experience of selling sex on street, but roughly 25% of the women that Roots Out are currently working with have sold sex in off-street venues. So by off-street venues, primarily we mean private residences, flats or Airbnbs within the city.
And your witness statements and the Rule 8 response refer to the fact that the women supported by Tara and Roots Out are very vulnerable and often have multiple intersecting disadvantages and protected characteristics. And I think the statements in Rule 8 refer to what you describe, I think, as the most common 15 or thereabouts. Could you please give His Lordship an idea of some of the most common, what some of the most common ones are, please? Both in relation to Tara, the women Tara supports, and Roots Out.
So for both those groups of women, we consider them to be amongst some of the most vulnerable and marginalised women within residing in Scotland. Both those cohorts of women present to services with a huge range of intersecting needs, but commonly those women are presenting to services because they are destitute or living in poverty. For many women, there is a need around homelessness services. Lots of women have issues with their mental health and trauma. Roots Out in particular, many women that Roots Out are engaging with have significant substance misuse challenges. And for women that Tara support, many of those women come from outside the UK and have additional vulnerabilities around, for example, their immigration status, their ability to navigate UK and Scottish society, language challenges, and for many women there can be a residual, for both groups there can be residual challenges around them engaging with services due to previous experiences either here within Scotland and Glasgow or wider within their countries of origin.
Thank you. And I think you also mentioned other vulnerabilities. For example, some of them are survivors of child abuse and or other forms of violence against women and girls, including forced marriage and other forms of cultural abuse. You speak about care experienced women with offending histories. You've mentioned financial issues. You also mentioned women with complex health issues, including mental health and or disabilities. What percentage of, or approximately, of the women have those health and or mental health disabilities?
I would say that the overwhelming majority of women accessing both TARA and Roots Out services are living with and surviving some form of trauma. TARA and Roots Out both are able to refer women to specialist psychological support for potential victims of trafficking. There is a legal right in Scotland to access psychological assessment and treatment if required, and that is a reflection of the significant trauma that women are living with for both cohorts. That trauma is multiple, and as you said, Laura, it comes from previous experiences and vulnerabilities of being survivors of other forms of male violence, including childhood exploitation, domestic abuse, other interpersonal forms of violence, and FGM, forced marriage. For the women that TARA support, quite often they have been vulnerable to being trafficked, and they have been very vulnerable to being approached by traffickers because they are fleeing other forms of gender-based violence. So a lot of women that TARA support, their traffickers took advantage of their situation where they were trying to escape other forms of male violence against women. For the women that Roots Out support, many have experience, are care experience, have been looked after and accommodated as children. And often that vulnerability is then again further exploited by individuals around them, and for both cohorts those vulnerabilities, I would argue, are further exploited by the men who are paying to have sex with them.
Thank you. And you also support, or some of the other vulnerabilities you mentioned are that you support trans women, women separated from their children due to migration or child protection issues, pregnant women and digitally excluded women, and we'll come on to talk about some of the impacts and disproportionate impacts shortly. But approximately what percentage of women supported by TARA and or Roots Out have one or more of these disadvantaged or protected characteristics?
An educated guess, I would say, again, the overwhelming majority of women would have a characteristic. Both groups of women, for different reasons, are quite often separated from their children. As I said, most have issues around trauma. I would say the majority had previous experiences of other forms of male violence against women, so I would say the majority of women would have one or more of those characteristics.
Thank you. I understand that TARA and Roots Out are part of the Encompass network. Could you please briefly explain to His Lordship what that is?
So the Encompass network is a network of services across Scotland who are providing specialist support to women selling or exchanging sex in the country. I think there were originally 9 members of that network. I think it's now 5, but there are colleagues within that network who are providing services, dedicated services to women in Aberdeen, Dundee and Edinburgh and Glasgow. And Perth and Kinross as well. I cannot forget Perth.
Thank you. And just in terms of you've touched on the link with Glasgow City Council, are TARA and Roots Out both services provided for by Glasgow City Council? Is that the link?
So both services, both TARA and Roots Out, are located within Glasgow City Council and always have been for a number of years. Roots Out supports only women selling or exchanging sex in the Glasgow City area, but TARA are funded to support women identified across Scotland, but we're located within Glasgow City Council.
Thank you. I'd now like to ask you some questions about the role of TARA and Roots Out during the pandemic itself. Could we, firstly, in relation to communication and engagement, how do TARA and Roots Out staff normally communicate with the women they support?
So Pre-pandemic levels, the support would predominantly be face-to-face. That would be initiated with telephone contact with the woman to check if she wanted to meet with services, her availability to make arrangements. But on the whole, support would be provided on a one-to-one face-to-face basis. Of course, Roots Out provide their outreach service, so that would be approaching women on street to check in with them, see how they were doing, find out if they needed access to any supplies or support. But in the main, it would be on an agreed one-to-one basis in person.
And how did that change, that engagement and communication, or the method of communication engagement change, if at all, during the pandemic?
So that changed to being for Roots Out, particularly case management work. So that's the one-to-one support work that predominantly went online or via the telephone. For Tara, it was a bit more complex than that, in that many of the women, particularly those women referred to as in situations of destitution where they did not have accommodation, our support had to continue on a face-to-face basis. Many of the women that Tara supported didn't even have access to a basic mobile phone, never mind digital access. So we continued to kind of work with women and work with other services to get women seen by us in person. For Tara, women who were already in receiving our support and who had outreach services, so who weren't in our accommodation but were still receiving support from us, that moved again to telephone support, and I'm sure we'll come on to talk about some of the challenges around moving that to kind of that digital access and that online or virtual one-to-one support. That was challenging, and I would say that was challenging for both services, especially in the early stages of the pandemic.
Did Tara or Roots Out need to make any other adaptations to their service delivery during the pandemic to be able to continue to provide the normal services?
So Tara in particular, many of the women that we support, English is not their first language, and especially in those early assessment meetings, we would always have used an interpreter. Pre-pandemic, that interpreter was always face-to-face. They also were able to provide us some kind of cultural mediation as well with that, but the kind of the pandemic meant that we were more and more reliant on telephone interpreting, and that brings its own challenges as well. Roots Out, there could be challenges for women who maybe didn't have a mobile phone, and Roots Out became very creative in ways they would leave messages for women at their pharmacies to call their worker where they knew women were going in to pick up a substitute prescription. So lots of creativity was put into play during those early days to make sure women were still able to access our support on an as-needed basis.
Thank you. Just to touch on key worker status, were Tara or Roots Out staff designated as key workers by Glasgow City Council, given the nature of the work you were undertaking?
Both teams were. We were, I understand it to be Category 2 key workers. That happened very quickly for both services, so I think from memory, it's in my statement for accuracy, I think by the 23rd of March, both services had been told we were key workers, and within a week we were both provided with, both services were provided with documentation to evidence that. So we were able to get key worker status very quickly, given the nature of the work that we do and the vulnerability of the women, and Tara in particular, we needed to be able to be out and about to meet women's needs.
And do you know whether the staff and volunteers of other similar organisations, either within the Encompass network or otherwise, were similarly able to get key worker status in other local authorities or within Glasgow City Council?
My understanding is that was more challenging for our colleagues, particularly those in the third sector. By virtue of being part of a local authority, we were, I suppose, in a privileged position where we were able to access that type of support much more quickly than others. So our chief executive, the routes up to the chief executive at that time were fairly simple, were made very quickly, and our documentation came through, as I say, within a week really of lockdown being introduced.
And do you have any insight, and it might be not something you can't answer, but any insight into some of the challenges that your colleagues providing similar services may perhaps experience by not having key worker status?
I wouldn't feel, I'm not sure I could answer that. I can talk about the key worker status meant our team were able to go out to see women, attend the office. That was done. They were confident in being able to do that. I think without that key worker status, I think that would be quite difficult to do, and to do and to keep your services and staff team on the right side of the policy and approach. So I think without that documentation being provided quite quickly, I think being able to provide an ongoing response would have been challenging based on our experience of having it.
Thank you. There's mention in your statement in relation to TARA at paragraph 59 of the fact that at times the TARA service felt that the key worker status was exploited by other organisations and stakeholders. Could you please provide some examples of why you say this for His Lordship?
So I think in the early stages, particularly with kind of lockdown, a lot of services and kind of other organisations that we would link in within the third sector through to kind of legal advisors closed their offices and everyone went remote. Remote working wasn't always achievable for Roots Out or TARA for our service users because of poverty, because of a lack of access. I mean, the women that TARA worked with would present in their clothes they were standing up in. They wouldn't have a smartphone, never mind the means to pay for data, to have kind of virtual meetings. So quite often we were the point of contact for other services. In the early stages, solicitors would ask us to get women's wet signature for legal aid applications until other measures were put in place. We quite often would get phone calls from other colleagues saying, oh, I need to speak to so-and-so, she doesn't have a phone, can you go out and give her her phone? So because people were aware that both services were still physically providing a service, that felt in the early stages that it was being taken advantage of, and certainly within TARA, we had, in 2020, we had staff expressing, not resentment, but a bit of, it's okay for them, they're home and they're safe. We're out meeting with women and at risk of catching COVID. So that certainly in the early stages, the team felt a bit taken advantage of by other services. We also had other organisations phoning us saying, oh, we've got somebody, we think she might have been trafficked, but she's standing outside our office. We're not very sure what the indicators are. Can you deal with that? So we would then have to be providing, contact with women, arranging to get them safely to our accommodation, all of which, particularly in the early stages of the pandemic, was really challenging.
Thank you. We'll come on shortly to discuss some of the key issues and impacts experienced by the women supported by TARA and Roots Out. But if you could please first, for His Lordship, give him an overview of the types of COVID-19 specific support that TARA and Roots Out provided. In other words, services that you wouldn't normally provide in non-pandemic times.
So for both services, a big role of the support workers was to explain a lot of the guidance that was coming out, and to explain to women what it meant, what restrictions meant, what lockdown meant, how to protect yourself from COVID. We were kind of providing a lot of that advice and guidance. For the women that TARA supported in the early stages, that was extremely challenging. There was a lot of information out there, but it was all in English, and it didn't really take account of women who could not speak or read English, and their needs didn't really take account of people who were literacy. Was a challenge either. So for both services, we were having to very quickly keep up with changing guidance and policy approaches and interpret those and make sure that women were able to understand what lockdown meant, what they could and they couldn't do. I think for Tara, that was especially challenging for the first few months until, and we were doing things like basically Googling for images to try to communicate to women what they could or they couldn't do. Doctors of the World translated guidance, but that came in towards the summer of 2020. So those early stages and that big, we were all frightened. And it was even more frightening when you knew something was going on and you didn't really know, and there were maybe members of your community telling you what you could or you couldn't do, but those members had misunderstood, or you know, that there was a lot of fear around it. Tara as well, many of the women that we support, you know, their previous experiences of governments in some of their own countries would be quite authoritarian. So there was a real anxiety around not doing the right thing. And we had one woman who she had just given birth and she was leaving her house once a week to go to the supermarket and back with her newborn, and it took us a lot of work to reassure her that she was allowed out for exercise, she was allowed out more than that, and that was important for the health of her and her wee one as well. So that was an example for Tara. Other items like wearing face masks, we were providing women with face masks. Again, the women that Tara support have very little financial means, and women were coming in saying masks were for sale in their local shop for £1. That was out with their their means, or they were re-wearing masks, so we were providing masks for women. And a similar thing with the women that Roots Out workers were continuing to support a lot of interpreting guidance and trying to explain to women what they could and they couldn't do to keep them right and keep them within the bounds of the law and the guidance at the time.
Thank you. We'll turn now to come on to discuss impacts on these women, on the service users. I think I'd like to, I'll come on in due course. You've already touched on the communication issues, and I'll come on in due course to ask you some more about that. But if I could ask you please to start by describing to His Lordship some of the key issues and impacts experienced by the women supported by Tara during the pandemic and the types of support provided, including in relation to, for example, financial, access to food, digital inclusion issues, mental health and well-being, etc. And as I said, we can come on again to discuss in more detail any particular communication issues. You mentioned earlier challenges for Roots Out and Tara in relation to the shift to moving to digital, and insofar as that applies to this discussion of the impacts, perhaps you can tease those out as well as you describe the impacts, please.
Okay, so one of the examples that I can give for Tara, and to a lesser extent Roots Out, but certainly for the women that Tara worked with, is they didn't have bank accounts or access to bank accounts. So while you or I, we were able to do online shops, for example, that couldn't happen for those women without access to a bank account. You know, Tara, we were able to provide women with some cash, but they certainly weren't able to kind of use, or women claiming asylum, they would get their money based on an Aspen card. My understanding is that card didn't work for kind of online shops. So some of those steps that was at our hands wasn't able to be used by the women that Tara supported. The move online to health services, for example, it all going online, that was really challenging for women who didn't have the IT equipment, who couldn't afford data on their phones. Women are not living in accommodation where they have Wi-Fi, so it's all on mobile data, which became incredibly expensive. Very difficult for women as well to kind of communicate over the phone with services, with health services too. So there were a lot of assumptions made, and people didn't think about the barriers to those assumptions. For the women that Tara worked with as well, and Roots Out, there's a whole range of safety considerations about online safety, that it's not as simple as giving somebody a phone and saying there's some data on that, off you go. For lots of women, there's no digital literacy, and ongoing online safety as well was another gap that we very quickly identified for women. But that wholesale move to, it's all okay, we'll do everything on Teams or on Zooms and we'll meet virtually and it'll be fine, that wasn't the case for a lot of women.
And access to food, you've spoken obviously about poverty and difficulty accessing funds and the Aspen card not working. Were there any particular issues in relation to food for the women supported by Tara, and any particular groups of women that were particularly disadvantaged in relation to food? And I'm thinking, for example, women housed in hotel accommodation.
So we worked very closely with our colleague in Refugee at the time to arrange food parcels to women that Tara were supporting. Rooteside were also able to access food parcels for their cohort of women through other means, so we were able to undertake that. Refugee in particular were pretty good at making sure that the food was kind of more culturally appropriate. The issue about women being accommodated in hotels, that was a challenge and continues to be a challenge. So women who had an ongoing claim for asylum or made a claim for asylum during that time were moved into hotel accommodation, which were catered, and meals were being provided at that. So breakfast, lunch and dinner was available and catered, which meant that for women in asylum hotels, they were provided with an additional £8 per week as living expenses, for want of a better description. For many of those women going into hotels, the food was unfamiliar. They had no control over when they would eat, when they wouldn't eat. There were lots of issues, particularly in the early stages, with the quality of food being provided, and it caused us some concern that it wasn't the most nutritious of meals. Chips with every meal, for example, that's not the best place. That was actively listened to by colleagues in Mears, and some steps were taken. But again, in the early stages, there were women in hotels where, you know, they were in their hotel room with a kettle and that was it, and they were not able to cater for their own food preferences, if you like, and that was challenging to meet their needs, and we worked very closely with Refugee around that too.
And in relation to, again, the women that Tara supports, any particular mental health and or well-being or social issues that they encountered?
So the women that we worked with, there was a huge, we had a huge concern about social isolation for those women. A lot of women, particularly when they were kind of newly identified in the early stages of the pandemic, were on their own. They didn't have a bubble, they didn't have friends or family living locally, and quite often, so they would be very, very isolated. Women who were not in our accommodation and were in asylum accommodation in the community, so flats in the community, quite often they didn't even have a television or a radio in that flat. So for some of the women that Tara worked with, they were in accommodation where they were sitting in silence on their own, day in, day out, not even a TV with background noise. So we used some of our privately donated funds to purchase televisions in order to try to alleviate some of that going forward. But that real lack of just human contact, I suppose. We undertook a commitment that everyone that we were supporting in 2020, 2021 would have we didn't close many cases, and everyone we would phone at least once a week. And for many women, our phone call was the only call they had during that time, and that was really, really challenging. We did organise, kind of try to get women together in parks where we could socially distance when that was available, and we linked in. But that also meant women were very vulnerable to kind of predators, I suppose, or other people who didn't have their best interests at heart within their community too. So there were lots of risks about socially isolating women in that way. And for some of the women that Tara worked with, that mirrored their experiences of being trafficked.
Thank you. And then turning to the women supported by Roots Out, are you able to sort of draw out any particular key impacts and issues and how they differed perhaps from the women that Tara supported?
There were kind of similar issues around kind of isolation and also kind of actors within their networks who maybe didn't have their best interests at heart. But Roots Out were able to very quickly make sure women were getting linked in with services and rights and entitlements. Roots Out talk in the statement, we tried to kind of reflect some of the positives that came out from many of the women that Roots Out were supporting. So those women were fast-tracked into supports, fast-tracked into benefits. That meant for many of those women, they no longer had to sell sex. They were able to get by on, you know, on the supports that were being provided at that time, and the speed of access to those supports made a difference for some of those women.
And just in terms of being able to come out and really this, you know, the successfully being able to come out of that in relation to financial pressures, could you please explain what was observed at the time in relation to the incidence of solicitation and about the demand for paid sex and exploitation during the pandemic, particularly in relation to the types of women that Roots Out supports?
So Roots Out, they, as we said earlier, they provided an outreach service in the evenings. At the time of the pandemic, their evening outreach was 4 nights a week, 8:30 p.m. to 1 a.m. And that they continue to provide a drop-in door service during that time, so any woman could still come to the premises, and there would be a socially distanced, appropriate response provided by staff. The proactive on-foot outreach stopped until August, I think, that year, whenever risk assessments and PPE were available to mitigate against some of the risks. What Roots Out did see was a drop in the women presenting, because the city centre became so very quiet. Women were very, very visible, and that certainly, you know, led to very few women being seen during that time. What Roots Out did find was we began to look at or observe some of the adult services websites that were available. We began to look at that just to see if there'd been a shift, you know, from women on street, or if there was any impact on those numbers. And we didn't. We found the numbers remain stable, and there's maybe time to go into some of the other nuances we observed. But what we did see for Roots Out during those weekly observations was, and shocked us, I've been doing this work for over 2 decades now, and I was pretty shocked, was that on like the likes of Craigslist, on the kind of the small ads, if you like, men were proactively advertising for women. So there were men, you know, saying, oh, if you're short of money because of furlough, I will pay so much for this sexual service. Men, sex for rent, men saying, oh, if you're struggling, you can come and live with me rent free, and we can provide, you know, I think there's some quotes within the statements. But that really shocked us, that men were openly advertising for sex online, and paid sex, and taking advantage of women's vulnerability and exploitation. And that was done with impunity. Really very, very little risk to those men. The online services that seemed to continue to go and continue with kind of no real consideration about the close contact nature of paying for sex and the risks that those men were bringing to women, but also returning back. What we know about the men who pay for sex is they're from all sorts of backgrounds. The majority have family at home, and they were risking not only the health of the women we work with and their own health, but the health of their family in terms of COVID and restrictions at the time. So that was a shock to me.
You spoke about some of the support provided by Roots Out to the women, the Glasgow women that you support, and enabling them to access service and a drop-off in solicitation. Was that the experience of women in similar situations across Scotland, or did that differ across the country? Obviously, Roots Out is embedded in Glasgow City Council. do you have any insight into what the experiences of women across the country?
I don't. My sense is I don't have any evidence for that, I'm afraid. My sense is it was similar patterns were seen. What I can tell you is Tara continued to get referrals for women from across Scotland. So women who were trafficked to Scotland to meet the demand, we continued to get referrals from women who were just being identified and just escaping situations of sexual exploitation. So it was continued to occur across the country.
And just in terms of women being able to or have services provided for them, was that something that was universal, or was that different across different local authorities?
In terms of specialist services?
In terms of, yes, accessibility to
So
services.
my understanding is Roots Out is the only specialist service that is funded by the local authority to meet the needs of that particular cohort. Other cities have specialist services. I don't think they're funded by the local authority. I think they're funded by different routes, and they're certainly not on the same scale as Roots Out in terms of staffing allocated to that. So I think they were in, Glasgow again was in a privileged position because of our history and work with this cohort. We were able to continue and provide a robust response. I know from my time at the meetings with colleagues from the Encompass network, they were able to access the funds from that were provided to Encompass specifically for women selling or exchanging sex across Scotland. So I know they were accessing those funds. I know they were continuing to provide a service. I think it's probably slightly more challenging context than Roots Out were.
Thank you. And just in terms of mental health and well-being and social impacts on the women in Glasgow that you were supporting, were there any particular aspects of that you'd want to flag or draw attention to?
I think Roots Out, it was kind of, it was similar, you know, those women about, again, it was about isolation, and it was about fear of what it meant, and a lot of the work that we were doing was trying to reassure women's fears around COVID and what they were reading and what they were seeing on television and not fully understanding. So I think both those services, it was about that, but it was also about trying to encourage general health, you know, and not just locking yourself away in your house, you know, that there were guidance about, you know, getting out in fresh air, that was there for a reason. And, you know, just again, it was about what's meant by a bubble, what can't you do, and it was really just trying to encourage women to think about what they were doing.
And just in terms of particularly vulnerable subgroups of women, were there any particularly vulnerable groups, for example, pregnant women and new mothers or women with children, and any particular challenges that they experienced?
So, yes, again, Tara, unfortunately, a frequent presentation or referral point for us is women who are in the very late stages of pregnancy. The pregnancy has been as a result of sexual exploitation, but they've had no previous antenatal care, so quite often they are referred to us or identified in the very late stages of pregnancy. So for those women, it was really challenging. Trying to make sure they were getting access to the supports that they needed. It must have been, we worked very closely with AMA, which are a birth companion service specifically for migrant women, but that was really challenging for those women about, you know, being out of that situation of exploitation, being in the very late stages of pregnancy that probably came about because of your exploitation, to then having to access unfamiliar services and give birth on your own. I think that was really very, very challenging for that cohort. So for the women that Tara supported, but also other, you know, pregnant women.
We've touched on already, Ms. Andrew, the issues, sorry, before we move on, were there any other key issues or impacts in relation to the women Roots Out supports, or either in Glasgow or across Scotland, that you'd want to flag at this stage? We obviously have your two statements and late response. We've touched on already, then moving on to pandemic information, communication and guidance challenges. You've already touched on some of the challenges for the women that Tara in particular supports. and some of the work that Tara and Roots Out were doing in terms of relaying or translating guidance. How did Tara and Roots Out stay informed about evolving public health guidance and regulations?
So that's a big question. So for us, because we were part of the City Council, we would get information in that route. We also, as workers and staff, we were living the pandemic alongside the women, so we were picking up guidance as well in our own lives too. That was coming in and informed what our understanding was. It was challenging though, although we were privileged, we were lucky that we had a very helpful health and safety colleague who went above and beyond, particularly for Tara, in terms of helping us access in the early stages PPE. It was really difficult to kind of understand the guidance and how quickly it was changing, and we're in lockdown, we're out of lockdown, we're not, and just trying to kind of keep on top of that. As the operations manager, particularly for Tara in the early stages, I was responsible for trying to pull together our risk assessment and our standard operating procedures going forward, and that was done. I do not have a background in PPE or contagious diseases, so that was really difficult for me in trying to kind of get the balance between the needs of the service and the women that we were supporting and the needs of our staff team as well, and trying to make sure everyone was safe during that time and that we were following the most up-to-date guidance was really difficult. Tara provide accommodation that's unsupported accommodation. It's scatter flats, so it's like flats in the community, but they are not staffed and they are unsupported. So trying to find public health guidance that fitted our service. We were not a residential service, but neither were we a solely outreach service either. So that was really challenging. We transport women, we have to go and collect women and bring them back to us. So kind of the guidance around how we physically did that was really difficult to kind of get your heads around and ensure, we weren't asking staff to risk themselves, and we were meeting all of that. So that was really challenging. The speed of change was difficult, and keeping on top of and making sure your risk assessment was robust, up to date, reflected changes. Those changes then went into operating procedures. I think I had 13 or 14 different versions of a standard operating procedure for Tara, and Roots Out had similar, what can we do, what can't we do, how do we manage, how do we keep everyone safe in this, and really make sure we were taking account of the well-being of our staff as well. Was a process.
Thank you. And you obviously did a lot of work in translating guidance for the women you support. But for that service that Roots Out and Tara provided, how accessible was the pandemic information for the women that Tara and Roots Out support? And were there any particular issues? You've touched on some already, cultural, language issues, etc. What, if you wouldn't mind just reiterating what those issues were?
I think, particularly in the early stages, the women that both services supported were really removed from the rest of what we were all able to hear. So they wouldn't be watching the news, they wouldn't be picking up, they would be listening, and there would be kind of rumour mills going, and they didn't have the same access to the information that the rest of us had, particularly in the beginning. And as I say, in particular for the women in Tara, all the guidance about hand washing, for example, that, happy birthday, you're like, and the singing, that's how long you wash your hands for. Those women, that was absolutely out with kind of their frame of reference or where they'd been, and like a lot of things, the whole information going out there, it was all written and in English and did not take account of, wasn't easily translated either. So that's the other thing, our jargon and the language that we use isn't readily translated. In the early stages of doing this work, the word trafficking as it pertained to human beings, there was quite often in other languages there was no equivalent of it. So that was something that I don't think was really considered either, about keeping things as simple as possible for the purposes of translation.
Thank you. You have a fair bit in your statement, so we won't have time to touch on it, about financial support, and so that'll all be taken into account. But just in terms of impacts on operations, we've touched on some of that already, but just in terms of impact specifically on TARA and Roots Out staff, or any other matters that you'd wish to highlight in relation to staff and issues for staff, I'd invite you to do that now, please.
Yeah, I think we were the same, along with a lot of other kind of frontline colleagues. There was just there were times, I think, that it was easy to forget that we were asking people to go out and undertake face-to-face work that they were doing and were committed to doing, and we forgot sometimes, or we didn't think about like the impact on them. Staff, and we were as frightened as everyone else was. I was going into the office, I had somebody at home who was shielding, all of these things, that all had an impact on frontline staff that I don't think was understood in the early stages. There were anecdotal kind of accounts of staff going out and with kind of their mask on, and then somebody from perhaps police been out with their N95 fitted mask, and we had wee paper masks, and all of those kind of things didn't necessarily filter through in the early stages, and it was very frightening for staff, particularly at the beginning. For TARA, one of the examples we have is that we provide women, for the first 90 days of support they get access, we provide them with a financial allowance, and that was provided in cash. We had staff going out to women's houses once a week in a car, pushing an envelope through a window to women, and women who were really pleased to see staff, and just the impact of that barrier between them. That's not been easily understood. As services, they worked at a pace and continued to work at a pace. They were all out providing frontline services in kind of quite a high risk environment, and that meant we were getting asked for information from a whole lot of different kind of people as well. So we were all working at a pace that kind of continued, and the kind of that physical impact on staff, I don't think is well understood or being understood until now. But I think for both Roots Out and TARA, those frontline staff undertook an already complex role in increasingly difficult circumstances, and did it, very. We're extremely committed to continuing to support those women.
Thank you. Are there any ongoing pandemic-related concerns or issues that you'd wish to highlight to His Lordship?
I think for both services, there still is a reliance on kind of virtual meetings and virtual digital inclusion. It's like that. What am I trying to say? So during the pandemic, it really came to our attention the digital exclusion that the women both services supported experienced. And one of the things from the pandemic is there is still a reliance on virtual engagements with women, and that works for some but not for all, and that doesn't take account of poverty and people's ability to pay for data to continue with that. Things have eased off a wee bit, but I think that kind of that whole, we've still got a group of people left behind when it comes to the changes to all of our lives around the internet, and access to that creates for us, and there are still people struggling to follow along with that change as we move forward.
And before I invite you to give comments on any potential lessons to be learned, are there any other impacts or issues, either ongoing or pre-existing, that you would like to flag up at this stage?
I don't think so. I tried to make sure everything was kind of captured in our witness statements and the Rule 8 notification, so nothing's coming to mind, I'm afraid.
Well,
Sorry.
as I said, we will take all of that into account. Well, then, if I could invite you, if you have any suggestions based on the experience of Roots Out and Tara during the pandemic, for what the Scottish Government could do to mitigate ongoing impacts of the strategic response to the pandemic, or could potentially do differently in future to improve matters in the event of another pandemic or similar emergency. What are the key learning points for the Scottish Government?
I think for me it's about communication and making sure communication is available to everyone. You know, that information is easily accessible and understood by everyone who's residing in Scotland at that time. That includes public information being routinely made available in other languages. Whenever we're writing it, considering, you know, the impact of translating it to make sure it's accurate. And I think, and I don't have the answers for this, we still struggle with it ourselves, but I think it's about how we communicate to those people who are most marginalised and most hidden from Scottish society, how we make sure that information is available to them, and that supports their, again, on an accessible basis for those individuals when they need it. But I think for me, the big thing about the pandemic was, how do we make sure people who don't speak English and who don't understand Scottish society and bureaucracy, how they are able to access that information to keep themselves and their loved ones safe?
Thank you very much. Ms. Andrew, I don't have any further questions. My Lord, I don't have any further questions for Ms. Andrew, unless your Lordship has any. That concludes the evidence.
Thank you. No, all that remains for me to do is to, Ms. Andrew, thank you for your very helpful evidence. I'm very grateful for your attendance here today. We will sit again at, let me get this right, 1:45. Yeah, 1:45. Thank you.
Thank you.